I think finally we are live. First of all, I would like to confirm that my voice is clear with you all. आज हम फिर से एक बार और वेबिनार को लेकर लाइव आ चुके हैं। इससे पहले कि हम शुरू करें, आप एक बार बता दें मेरी आवाज़ ठीक से आ रही है क्या? जी हाँ, मैं कुछ सेकंड का वेट कर रहा हूँ आपके कमेंट्स का, ताकि हम फिर से इस सेशन को कंटिन्यू कर पाएँ। जी हाँ, एम आई ऑडिबल टू ऑल? सभी को नमस्ते। जी हाँ, हम लोग लाइव आ चुके हैं। आज के 7 बज गए हैं और हम थोड़ा सा विलम्ब है, माफ़ी चाहते हैं। बिफोर वी स्टार्ट विद यस हेलो हेलो, गीता यहाँ पे कनेक्ट है। एक बार आप बताइए हमारी आवाज़ ठीक से आ रही है क्या? यदि ऐसा है तो हम आज के सेशन को शुरू कर लेते हैं। गुड इवनिंग जी, गुड इवनिंग है, सभी को नमस्ते है। एक बार आप बताइए मेरी आवाज़ सही है क्या? यदि ऐसा है तो हम आगे कंटिन्यू कर रहे हैं। गुड इवनिंग है जी, सभी को नमस्ते। एम आई ऑडिबल क्लियरली एंड विजिबल? मेरी ऑडियो और वीडियो ठीक से क्लियर है क्या? एक बार आप बता दें। Yes, sound is fine. Okay. Good evening. Okay. Please continue, please. Thank you. You are audible. Thank you so much. So, first of all, I would like to pay a beautiful thanks to our resource person as well as the participant for joining us. आज हम 146वां वेबिनार हम कर रहे हैं। आप सभी को जान के अच्छा लगेगा कि अभी तक हम 145 फ्री वेबिनार इसी यूट्यूब चैनल पे, लिंक्डइन और साथ साथ फेसबुक पे हम इसे लाइव डाल चुके हैं। आप चाहें तो पुराने वेबिनार भी देख सकते हैं। आज इसी सीरीज को हम आगे कंटिन्यू कर रहे हैं। मेरा नाम राज आलमपुर है और मैं एक मनोवैज्ञानिक हूँ। I am practicing in city Rohtak. Along with, I am also working with military services, Indian Army in Hisar Kent. एंड साथ साथ मैं फैमिली कोर्ट्स में भी काम कर रहा हूँ, जो फैमिलीज रिलेशनशिप इशू रहते हैं। साथ के साथ हम लोग चला रहे हैं पर्सनैलिटी केयर फाउंडेशन को। आई एम द फाउंडर मेंबर और हम लोग बात करते हैं मेंटल हेल्थ पे और साइकोलॉजी पे। इसी के आसपास जितने भी टॉपिक रहते हैं, हमारा टारगेट है कि ज़्यादा से ज़्यादा लोगों तक अवेयरनेस पहुँचे। मेंटल हेल्थ इज़ मोर इम्पोर्टेंट एज कम्पेयर टू फिजिकल। इसी सीरीज को ध्यान में रखते हुए आज हम 146वां वेबिनार कर रहे हैं और इसी के साथ, जी हाँ शुभम, आपका वेलकम है। सो इसी को ध्यान में रखते हुए हम 146वां वेबिनार आज कर रहे हैं, जिसके रिसोर्स पर्सन हमारे सभी के पहले से भी परिचित हैं। मैं ज़्यादा समय न लेता हुआ आप सभी को एक दो सूचना देकर उन्हें इन्वाइट कर रहा हूँ। सबसे पहली बात कि आप इसी डिस्क्रिप्शन से हमारे सर्टिफिकेट को क्लेम कर सकते हैं। साथ के साथ आप एक फ्री मेंबरशिप भी ले सकते हैं पर्सनैलिटी केयर फाउंडेशन के। लगभग हर सिटी में पूरे इंडिया में कुछ न कुछ मेंबर्स हमारे साथ ऑलरेडी ही कनेक्टेड हैं और यदि आप चाहें तो दूसरे भी पुराने वेबिनार देख सकते हैं। आइए धीरे धीरे साथी हमारे साथ कनेक्ट हो रहे हैं। हम लोग ज़्यादा समय न लेते हुए आज के हमारे रिसोर्स पर्सन को इन्वाइट करना चाहेंगे। सबसे पहले before we start, I would like to pay a beautiful thanks to Dr. Sonali Mukherjee मैम। उन्होंने अपना कीमती समय निकाला और मुझे पता चला कि उनका हेक्टिक ही स्केड्यूल रहा है पिछले वीक से, तो मैं उनको बहुत बहुत शुक्रिया करना चाहूँगा कि उन्होंने इसे ज़रूरी समझा और आखिरकार सेशन को अंजाम दिया। आप बात करने वाले हैं मैम ADHD पे। फिलहाल मैं सभी ऑडियंस को कहूँगा एक प्यारा सा वेलकम वो लिखें अपनी तरफ से, जहाँ से भी वो उन्हें सुन रहे हैं। आप हैं डॉक्टर सोनाली मैम, आप असिस्टेंट प्रोफेसर हैं क्राइप्स, जो यूनिवर्सिटी है NCR दिल्ली में, और भी दूसरी जगह आप जानते हैं उनके कैंपस हैं। आप वहाँ साइकोलॉजी में बच्चों को पढ़ाते हैं। पढ़ाने के अलावा आप पहले भी हमारे साथ कनेक्ट हुए हैं, तो मैं समझ सकता हूँ कि आप ना सिर्फ पढ़ाते हैं बल्कि आप साइकोलॉजी के जो अप्लाइड चीज़ें हैं, जो काउंसलिंग है, थेरेपेटिक इंटरवेंशन है, वेबिनार हैं, अवेयरनेस हैं, उन सब चीज़ों पे आप काम करते हैं और हमें बहुत ही खुशी हो रही है कि आज आप हमारे साथ कनेक्ट हुए हैं। आपका मैं बहुत-बहुत शुक्रिया, आपका जुड़ने के लिए बहुत-बहुत शुक्रिया। नाउ इट्स ओवर टू यू मैम।
Thank you, sir. Thank you so much for a warm welcome. So today I will be discussing with you about ADHD, which is very common about these days. And as you all are aware, and good evening, first of all, to all the audience present over here. So particularly, I will be focusing on this webinar about the understanding about ADHD, which is attention deficit hyperactivity disorder. So today, before begin my formal presentation, I would like to just give a brief background in order to set the tone of the presentation. So these days, you must have seen there are a lot of cases which is coming up with the neurodiversity, which includes your ADHD, autism, intellectual disability, dyslexia, and so on. Majorly these four. So I would like to say before like commenting or have a myth or have a misconception about ADHD, we need to first understand its symptoms, its etiology, that is the causes. What are the various characteristics of ADHD, that is the red flaggers, which we need to understand rather than to ignore. And then some behavioral tips or the strategies, not only for the educators or the school counselors or the special aids, but also I would like to focus over here about the parents, because I think parents are someone, they are the active agents of their ward, and their responsibility is something which is very immense, apart from the special educators, therapists, counselors, psychologists, and so on. So before going to further delay, I will focus first on the characteristics and the etiology part, and then I will be focusing more on the strategies, which not only catering to the psychologist, but I will also focusing about certain tips, certain strategies which can be used by either of the parents or might be both the parents can be involved. So setting the tone, I would like to start my formal presentation. Yes. So I would like to tell you that ADHD is basically a neurodevelopmental disorder which affects primarily three domains: your inattention, hyperactivity, and your impulsivity, which affects your attention, impulse control, and activity regulation. It can continue till adulthood, and it can be, the symptoms can be seen from 3 years onwards. Although the formal diagnosis, which can be done for ADHD, can start by the age of 5, but below 5 also there can be symptoms, there can be red flaggers, which very clearly a parent can understand a clear difference between a neurodivergent individual or a child as compared to the neurotypical children, right? Now, neurodivergence children, which includes your ADHD, ASD, ID, and dyslexia. So over here, I would like to tell you a little subtle difference between the two. Neurodivergence individuals, their brains has been wired a little different in terms of their emotional regulation, in terms of cognitive processing, in terms of your social processing, and in terms of understanding the things, which includes your executive functions. Neurotypical individuals, they can understand each things in a very linear process, in a step-by-step process, where they doesn't have any kind of problem, wherein in terms of executive functions, their cognitive functions, focusing their attention in any of the cognitive tasks, and so on. So now coming to the ADHD children, this actually involves wherein a diagnosis, a formal diagnosis is very much important. Somewhere down the line, which I have also observed with my 15 years of experience, because I worked in this area of dyslexia and ADHD. I've completed my PhD in the area of dyslexia. I have found out that children generally, when they have such kind of behavior, parents, their behavior is something which is not at all appropriate. What they say is that okay, it can be delayed, the बच्चा शैतान है, बच्चा कर नहीं रहा है, बच्चे में बहुत for the parents to understand. As a special ed, as a counselor, we need to understand why the child is behaving like this. To a certain extent, if the child is doing and understanding the things based on your conversation, based on your counseling, if the child can able to understand, then it is correct to some extent. But if the child is keep on doing it after your counseling, after your you can say a discussion or an agreement, or you can say a slight scolding kind of thing, if the child cannot able to understand the things, that means there is a problem at the neurological level which you cannot able to ignore, right? So that's why I told very clearly that the symptoms can be very clearly visible at the age of 3 years, but a formal diagnosis can start by the age of 5 years and so on. And ADHD can continue till the adulthood. Next slide, please. So this is the ADHD is one of the most researched childhood disorders, where we have seen 3 persistent patterns: inattention, hyperactivity, and impulsivity. Hyper inattention, when I talk about that, these are the children, those who have they doesn't lack attention, but the only problem for these kids is it is very difficult for these children to sustain their attention in certain tasks which demands your attention, which demands your cognitive task, and which demands your you can say a sustained attention in that particular assignment or work which has been engaged or assigned to the task. Now, hyperactivity is something where you can see that the child uses the fidgetity, restlessness, like sitting in the chair for a period of at least 30 minutes or 20 minutes, or let's say for just for 15 minutes. It is very, very difficult for the child to sit. Impulsivity is something that is it's very important to understand that they have an impulsive behavior, and for which they have an emotion regulation which is very difficult to sustain. Their executive functions, which is actually important for them to understand in order to plan the things, in order to, you can say, organize the things, take logical decisions. These are the something which is lagging in the ADHD kids. But it's not only the thing that they cannot do it. The basic purpose over here is a formal diagnosis together with it, a formal therapy, a continued therapy, not a disrupted therapy, and a parent's involvement in those therapies is immense. And with this, you can see a change in the child's behavior, right? See, there is no permanent cure to ADHD, which we cannot say that after a period of time, there will be a permanent cure. But with the time, you can see that the behavior has been managed, right, to some extent. The child can learn certain self-help skills where they can earn their livelihood, they can deal their life, right? But over here, again, the point which is coming is somewhere down the line, parents have to take an active role. So the symptoms which interfere is for the development and the daily functioning. This has been diagnosed in DSM criteria 5, and the symptoms must appear before the age of 12, right? So 3 to 12 years, very clearly you can observe the child's behavior, the child's symptoms, or maybe certain actions which can be spotted as a red flagger for the child or for the parents to focus. Next slide, please. So I would like to convey over here is what is the prevalence rate of ADHD, which affects 5 to 7% of children globally, more common in boys, across cultures and socioeconomic groups. In India, ADHD affects roughly 1.6 to 29.2%. If you see, now the percentage is increasing day by day. It's not because of certain one definite gene problem, right? There's no definite the cause for ADHD. There's a multiple combinations. Because of this, the ADHD is being diagnosed, or maybe it has been detected. So first is Over here, it can be because of certain toxins, maybe because of the mother's lifestyle during the 9 months, because of certain environmental factors that the mother didn't got that support system from the family. That is, which is very, very important, right? Another important thing is might be that because of the lack of nutrition, the child has didn't got the enough nutrition from the mother, and that's the very reason that the child has diagnosed with ADHD, and there is some kind of specific gene which is responsible for ADHD as well. But as far so far from the researchers, it has been observed and it has been documented well that there is no one significant gene which is responsible for ADHD. So now the percentage is increasing. Why the percentage is increasing is because of the day-to-day environmental factors. These environmental factors, the stressors which is there, which we need to understand how we need to, you can say you can mitigate to some extent, or you can say to some extent you can change your lifestyle. You can do some kind of meditation or yoga, especially during these 9 months, such that you give a birth to a healthy baby, right? So a nationwide average of 7.1% among children and adolescents. Rates for adults is ranged from 5.5% to 25.7%. And this is the data which I'm providing is a very recent data of 2025. ADHD is very commonly seen in boys, right, rather than girls, can persist into adults, adolescence and adulthood. Increased awareness has improved the diagnosis test. Now, if you see, government has given so many acts. RPWD Act is there, your National Education Policy, NEP is there, your right of children with compulsory education. All these acts are there, which government is giving a proper benefits to these neurodivergent children. But the catch over here is, although the awareness is there among the people, and these awareness led to the, you can say, an enhancement in the diagnosis, and the percentage has been increased, right? But the major problem which is there is at the ground reality when the child is studying in a mainstream education, it is very difficult. And I myself been a counselor for 3 years from 2015 to 2020. I have been as a counselor and as a PGT teacher as well. I myself has observed that the ground reality is very different. Parents are not taking so much of active role. Teachers are sending the kids only to the special ed rooms without taking an active role in the classroom engagement. They are not making any kind of systemic changes or any kind of, you can say, pedagogical changes or instructional changes in their teaching pedagogy, right? So when we do all these things, what we have to do is, NEP very clearly lays down the principle is education is for all. It's not only for the neurotypical individual. It's all for all the individuals, irrespective of their abilities, irrespective of their problems, irrespective of their disorders, right? So when we're talking about all these things, we have to see our NPC curve. Now, NPC curve is our normal probability curve, which at the center, we say that all the children is coming to one. We're talking about inclusion. And when we're talking about inclusion, we cannot seclude them from our society. They are a part of our society. We have to make certain changes in the school curriculum, right? In the instructional method, in the pedagogical pattern, such that they are a part of the active learning. Apart from this, which is very important, is based on the activities. Now, some of the activities teachers design in such a way where the neurodivergent individuals cannot able to participate, which is not at all correct. You can make certain changes in your activities, at least not 80% participation is required or might be cannot able to possible for these kids. At least 15 to 20% participation, if they do it during this pattern, you can see a consistent, you can see very clear, you can see a growth in these children, a high in self-esteem, and at the same time, a sense of belongingness with the peers will also be observed. So this is present across all cultures. It's not that it's present only in Indian context. It is present globally and across all the socioeconomic groups as well. Next slide, please. Yeah, now I talk about the types of ADHD, which is predominantly inattentive type, which is difficult in focusing, which in the previous slide I very clearly talked about. They have difficulty in focusing in the sustained attention. They easily get distracted, even if a pencil drops down from the desk. They very clearly see why it happened, and they have entire attention over there, that why the pencil dropped down. They will start playing with their pencil and so on. So it is very difficult again to back their attention back to the focus, right? Predominantly hyperactive and impulsive type, excessive movement they have, difficulty waiting for their own turn to give the answer or might be participate in some activity, right? They have a kind of fidgetity and restlessness during the classroom or during the at the home environment as well. And the third is a combined type of both inattentive and hyperactivity, where you can very clearly see they have a kind of impulsive behavior, and this impulsive behavior need to be very clearly laid down during the developmental years, right? During the years when the parents are trying to make them understand to try to wait for your turn, don't be impulsive. There are certain things, there are certain tips or strategies which a parent can very clearly do. The only thing is they have to give a quality time, which is very important. Which is a sad point over here is, since both the parents in, especially in Delhi NCR, both the parents are working, it is very difficult, I can say, to give the time to the kid, right? But if you're ignoring the kid, at the same time, you see that the bond which is important between a child and a parent, that is completely missing, right? Because now the screen time has been enhanced so much. If you give a little time to a child, okay, you watch mobile phone and I'll do my work, that means you yourself is actually encouraging the child to present himself or present before the screen time, and they are enhancing their screen time, because of which all these things, their hyperactivity and the impulsive behavior will increase, right? Next slide, please. Now, the etiology of ADHD, which I already covered in the previous slide, is there can be a genetic factors, right? ADHD can be multifactorial origin. It can be caused by a combination of genetic factors, neurological differences, and environmental influences as well. Now, there is no single cause which has been identified by most of the researchers, which has been documented so far. There's no single gene which has been identified. There's no single cause of ADHD, but a combination of genetic neurological differences, especially in the prefrontal cortex, right? So in the next slide, I will tell you about the 4 lobes, about the prefrontal cortex, which plays a vital role in our logical decision and emotional regulation, your sustained attention. These are the things which is actually played a very immense role by the prefrontal cortex. Next slide, please. Now, the genetic factors over here is a strong hereditary basis, might be run in the families. It can be associated with certain genes affecting dopamine regulation. Family history increases the likelihood of ADHD as well. So see, whenever there is a formal diagnosis done by a psychologist, by a clinical psychologist, they very clearly say that it can be, they ask their parents that is it running in the families? Is there any child in your family having the symptoms of ADHD but not diagnosed properly? Also, at the same time, they see that is it because of certain environmental factors, because of this the child has acquired these symptoms, right? It might be at the birth the child doesn't have any kind of problem, or it might be by the age of 3-4 years the child doesn't have, but it has been acquired because of certain environmental family factors, because of the marital discord between the parents, the child has developed these symptoms, right? Next slide, please. Now, coming to the neurological basis, which is the most important part, is prefrontal cortex involvement. Prefrontal cortex, we have 4 lobes in our brain. First is the frontal lobe, second is occipital lobe, third is parietal lobe, and fourth is the temporal lobe, right? Now, out of these 4 lobes, prefrontal cortex, which is predominantly is in the frontal lobe, which actually affects your attention, planning, self-control, and this is actually specialized, this prefrontal cortex specialized for your planning, organization, self-regulation, decision making, which is actually very, very important for all these things is your executive functioning. Now, the researches which has been done so far is basically they have actually tabbed about the executive functioning, which is actually have a difficulty for ADHD kids to actually understand the problems in terms of their planning. They doesn't have any kind of proper planning, right? They cannot able to organize the things properly. At the same time, their self-regulation is very important, right? So here there's a imbalance between the both two neurotransmitters, that is dopamine and norepinephrine. Because of these imbalance of these neurotransmitters, ADHD is being diagnosed, or ADHD can be one of the causes, or ADHD can be very clearly you can see the symptoms of it. So in order to understand their planning and everything, what we can do as a academician, as a psychologist, very clearly we can give a very small and a clear instructions to the child, and each instruction can be given one at a time, right? That is, they can learn step by step, but each step has to be very small, instruction has to be very small, a clear defined, a clear simple or a Hindi language which can be used by the parent or a special ed. At the same time, to ensure that they have understood or not, it's the best is ask the child to paraphrase what they have understood, right? Such that you can very clearly see that they know what to execute and what to do. This is how our executive functioning can be, you can say, improved, right? At the same time, slowly and gradually you can see there's a change in the child's behavior in terms of planning and organization, where you have to use certain behavioral therapy tips or behavioral therapy strategies at home and at the school level, where you can see that the child is now started taking responsibility, which earlier was totally absent. Clear? Next slide, please. Now, coming to the environmental risk factors, which is very, very important, right? Prenatal exposure, premature birth, brain injury, and lead exposure, right? Prenatal exposure to alcohol or smoking or drugs, toxins, which I already told you. Premature birth or low birth weight. Now, see, basically, the mothers, those who are working in corporate sectors, or you can say BPOs or other private sectors, very clearly you can see the lifestyle is very different, right? Now, how the lifestyle is different is they have a status symbol of consuming alcohol, right? Smoking, drugs, which is something they consider this as a status symbol. They consider this as that yes, you are a part of the society, and if you are consuming alcohol and smoking, that very clearly seems that yes, you are a part of our group and you are a part of our club. If you're not doing it, that means that you're an obsolete person, right? You're an outdated person, and because of which that person need to face certain kind of rejection from their own in-group members. In order to be confirmed, in order to show their conformity with the in-group members, this women, they start consuming alcohol, right? Which is to some extent not at all correct, especially when when a woman has conceived a baby, because these can be as a predominant factors because of which you can see later on some symptoms of ADHD in the child, right? So premature birth can be a low birth weight, brain injury which can happen during the you can say during delivery, or maybe during, so after the delivery it can be a brain injury which happened for the infant. Exposure to the toxins, lead, which I already told you, and high psychosocial stress, which is now these days, these are the major component, that is your environmental stressors. These are very, very important, and because of this, the mother is actually struggling because they choose a dual career, right? When we talk about the dual career, they are focusing on the household chores, they're focusing on the workplace, and because of the work demand, they cannot able to take a proper sleep of 7 to 8 hours, which is very important, especially during these 9 months. Because of this, they are not taking a proper diet and nutritious diet, and or because of all these factors, it is actually affecting the fetus, right? It's actually affecting the baby. So because, and also a lack of support system, which is the mother is not getting it from their spouse, or maybe from the in-laws, or maybe from other extended people, even from the workplace as well. So these are the something which I can tell you, which is a basic important factors. And now these days, these psychosocial stressors are something which is very, very important, because the work-life balance is no more there, especially if a mother is a working mother, right? If a mother is a working, it actually has a lot of demand on that women, that you do the household chores, you manage the workplace, you do the other things, like you can do the other social work, or other, you can manage the outer things at outside the home. If they manage all these things, what is the time left for their own mental health? That means they're ignoring their own mental health, their own physical health. And because of all these things, who is suffering is the mother and the child. Throughout life, the suffer is only for the mother and the child, because might be a father can also will have actually empathize with all those things, but his empathize or his empathy is something little less, I can very clearly say, as compared to the mother who gave birth to a child, right? Because it is very close connection, it's a very close bond between the mother and a child, where you can very clearly see that the mother is the one who is most affected, and the most, you can say, a self blame kind of thing will be happening, and a guilt will also be there, that because of me, might be my child has certain problems. Next slide, please. Now, the symptoms of the inattention can be difficulty in sustaining attention, makes careless mistakes, does not seem to listen, difficulty in organizing tasks, avoid mentally demanding work, often loses things, easily distracted, forgetful in daily activities as well. Now, these sustained attention, I would say, it's not only which is very clearly prominent in ADHD. This is very clearly say, you can say, in these kids, other than apart from ADHD, you can see these days in the neurotypical children as well, right? Why? Because of the screen time, because of the excessive usage of the screen time, children have difficulty in sustaining attention. The children have doesn't have any kind of bond with the parents, or might be their interpersonal relations with the parents or with their siblings at home, they doesn't have that clear close connection with them, right? They and because of all these things, the consequences that they are always in a hurry, they make a lot of careless mistakes during the examination, during the day-to-day work, right? They have a difficulty in organizing tasks, their difficulty in organizing or putting the things in their cupboard, or in their, you can say, in their bags. Often you can see the messy things are there, they're very easily distracted, and they always tend to forget their daily activities which they need to perform. Now, coming to all these things, which I can very clearly say is why these things are happening, why this is, or it is not, inattention is only not because of the ADHD it has been diagnosed. It has certain things on the neurotypical children, on the children doesn't have any kind of diagnosis, formal diagnosis, still they have, because first and foremost is a child is not getting a clear attention from the parents, right? First. Second is maybe a child is a single child at home. There is no one at home to whom the child will interact. There is no one at home to whom they can play with them. They doesn't have anyone with whom they can spend a quality time, because of the family structure as well. This plays a very vital role. Now, this era, if you can see, the family structure plays a vital role. Now these days we are all staying in nuclear family. If you go back to the other generation, those who are staying with the joint family or extended family, you can see the cases of these kind is little less, the prevalence rate was less. It's not only a sole reason I'm telling you, but there are, yes, other reasons. There can be the symptoms which were there, which was went undiagnosed. But yes, this can also be one of the factors. Since we are staying in a nuclear family and the less family members are there, there's no interaction with the parents. Because of this, the child needs certain attention, and that attention they're giving entire thing to their screen time. They're more happy with their screen time. They feel connected with them. They develop a bond with the screen, right? It can be mobile phones, it can be TV, it can be laptop, it can be their tab or any other things. Next slide, please. Symptoms of hyperactivity, which is frigidity, where they cannot able to sit at one place for at least 5-10 minutes or more than that. Excessive talking. Now, excessive talking to some extent, you can say that many people you would have found around your gatherings, that there are many kids or children or adults, they are talking excessively, right? If they're talking excessively without any sense, or in you can say where they need a demanded attention or a cognitive task which is required, at that time also the child is talking excessive, that shows that the child cannot able to pay attention to that task. And in order to seek the attention of others, they are doing all these things such that they will drop off their attention to some other task, and they will give entire attention to this kid, right? Running or climbing in inappropriate situations, difficulties staying seated in the classroom, constant movement and restlessness is also there. So in hyperactivity, we have to see as a accommodation what strategies which we can do, how it can help their sitting behavior increased, right? And during the kindergarten school, the mother teachers, what they do is they try to sustain their attention with some cognitive tasks, with some engaging tasks, with some interesting tasks, where the child feel that there is a clear connection to what the child is doing. The child is seeking that happiness out of that work. At the same time, the child is actually have a good output of that work which they're trying to do. So we need to understand what is the choice of your activity, what is your, how you're designing your activity, or what is the kind of work which you're giving to these kids. So you have to be extra mindful rather than just doing the things or just giving the things whatever you feel it, right? You have to be extra mindful, especially when you're dealing with the neurodivergent individuals. Next slide, please. Now, symptoms of impulsivity. The impulsivity, basically, if you can see, they're interrupting others. Might be two people are talking. There's a common courtesy. We wait for a turn and then we speak. That's a very common courtesy, which we all do it. And we all learn all these things at home. There are basic things, if you see, there are many things we learn it from our home. How you behave, how you present yourself, right? How you are putting yourself in the outside world, how you carry yourself, all these things we learn from our home, right? So these ADHD kids, they often interrupt others, especially when both are talking. They have a very difficult and wait for their turn to speak or to do an assignment or to do any activity kind of thing, right? They just blurt out their answers, and they think that whatever is there in my mind, I just want to speak out first, right? And they take an actions without thinking, without any thinking. They just take a quick action. They don't give a second thought that what I'm going to speak, will it be okay to speak at this particular time. They cannot able to understand the context in where they are speaking, right? And also there's the emotional outburst as well. Now, why this emotional outburst? Because when they're not able to get the recognition of the people, right? Or when they cannot able to get a due attention from the people, either they start shouting or they're doing certain behaviors in order to grab the attention of others, or there can be emotional outbursts as well. Risk-taking behaviors. In these kids, we have to be extra vigilant. We have to be extra, you can say, aware that what kind of work they are doing it. Risk-taking behavior might be they're doing certain things. They're using the scales, and they're trying to cut their fingers, or through knife they're trying to cut their nerves or something like that, where they do certain kind of risk-taking behaviors, either for themselves or might be for others as well. So we have to be extra vigilant what type of work they're doing, what are their kind of actions which they are doing, and what will be the impact of it. So when we consider about the 4 Ds which we already read in our abnormal or a psychopathology behavior, we try to understand the deviance, danger, dysfunction and distress as well. So when we understand all these things, we very clearly understand they do certain behaviors which is risk taking without understanding the impact, without understanding the urgency, without understanding what will be the impact of those behaviors if they do such things. Might be they're doing a small collage activity and they're using the knife to cut their fingers, or might be their nerves, or they're putting a scratch on their hand only, right? This kind of behavior which can be very often found out in the kids of ADHD and ASD, especially for high functional autism children. Next slide, please. Now, coming to the characteristics of children with ADHD is short attention span. They have a very short attention span. You can say it's only just, you can say 5 to 7 minutes, right? Or maybe less than that. Emotional dysregulation is there, poor time management. They cannot able to manage their time properly, right? They have a very difficulty in following the instructions of the parents, special ed teachers, and other people as well, right? They have a difficulty in following instructions. Why? Because in my previous slide, I very clearly told they have a problem in their executive functions. That is their prefrontal cortex in the brain over here, right? So when they have a problem over here, what is the solution? Now, when this webinar is not only just discussing about that these are the characteristics, these are the symptoms, I have to tell you about certain strategies, certain tips, which you as a parent, you as academician, you as a specialist, you can do it at homes, at your clinics, where you can see a kind of improvement. Because if you see a 0.1 or a 2% improvement in an ADHD kid, very clearly you can see that yes, your work or your activities which you're designed is something proved to be true, right? So they have another thing which you can see in the ADHD kids is they have a too much of energy, very much. Their energy level is too much, right? So you have certain activities where you can see that they have these the energy which is there. You need to channelize their energy, right? Either you can do certain activities, you can do certain outdoor games with them, you can do swimming, you can do basketball, any other game which is through which they can channelize their energy in a proper, you can say in a proper channel, right? Where they can earn or learn certain things. At the same time, you see that the child is quite engaged in those activities, right? So when a parent cannot able to decide that what activities to design, they need to connect with the psychologist, which is very important. You cannot decide everything on your own, right? Being as a parent, you have to be an active parents. You have to understand if my child is behaving like this, you cannot simply sit idle at home. You have to make certain accommodations, right, at the home, at your school level, by requesting the administrators by systemic changes. Also, you have to consult with a proper clinical psychologist where they can help you out to manage their behavior both at the school level and at the home as well. Next slide, please. So when you say about the characteristics, now these characteristics actually, it's been very clearly, you can see when they are getting admission in the schools. It can be integrated school, it can be a specialist school, it can be inclusive education as well. So there are certain challenges for these kids, right? And these challenges you can very clearly see, first of all, on their academic underachievement, right? Very clearly, because a neurodivergent individual, you cannot expect that they will score too high, right? Might be they can score. The only thing is, what is your pedagogical system? What is your instructional method, right? What are the things which they are trying to do it? What are the you can say modifications which you are doing it in your paper? Because according to the CBSE bylaws, which they say very clearly, and according to the National Education Policy, which recently came in 2020, in June 2020, where they very clearly lay down the principle that till the grade 8, a child can get a modified paper. right? If a child is getting a modified paper, they are getting a little simple paper, and that paper can be maybe a fillers kind of thing, a true and false kind of thing, match the following, you can say one line answers kind of thing you are giving to the child. If the child can able to accommodate, or the child can able to learn through these things, you can very clearly see that yes, there is a kind of improvement. But the catch over here is, since CBSE has given till grade 8, what about 9, 10, 11, 12? That is a basic, biggest challenge on these kids. Because till grade 8, you are giving them a baked cake to them. You're giving a simplified paper, you're giving modified paper, but from 9 onwards, you are not giving any kind of accommodations like this, right? So you have to make certain changes. And what changes can be? That changes at the school level can be a little more attention to these kids, right? A buddy system can be very clearly be introduced in the class. At the same time, a student who is a little responsible can be sitting with the teacher, with that kid, such that this kid can actually help the ADHD kid to make them do certain things, to make them understand the things, to make them do their homework or make them do their classwork, and so on. So if you introduce a buddy system, which can be very, very useful for these kind of neurodivergent individuals. Second is, it's very difficult in completing their tasks, very difficult. Why? Because generally, when they're copying it from the board, might be they will not copy the entire thing. They'll get easily tired, right? They're not willing to write. They have a lot of mood swings, and they'll shut the notebook. So what in this context also, a buddy can be very helpful for these kids. And this ADHD children can be sitting very close to the class teacher or the subject teacher. The sitting arrangement is a little important during the systemic changes in your classroom, infrastructure changes, right? Ask the child to sit in front of the class teacher. The rotation should not be there for these kids. Ask the child to sit in front always along with a buddy, which is very important, right? Rather than, which I personally has observed, that these kids either have been asked to sit at a corner without anybody, without any partner, right? So if your child is sitting at the corner of the room, what a child will think? That yes, I know I have a problem. The self-esteem will low, right? They will not take an active part in any of the activities, neither in the classroom engagement or any kind of work which the child is doing it or they're supposed to do it. Frequent, since they have a frequent distractions, so you have to do a small kind of activity which a teacher can very easily do it, all these things in their zero period. The zero period, which is of 30 or 35 minutes in all the schools which is there, this can be used in a very optimal way, right? It can be used in developing a bond with the kids. It can be used in a very judicious way where you can design a simple activity of 20-25 minutes where you can see a kind of engagement and a sense of belongingness along with the peers and along with the teachers as well. Peer relationship problems, yes, they have peer relationship problems because they cannot able to make a very clear bond, right? Even if they develop a bond, that bond will be very immense only with one child, and who will be might be a close buddy of that kid as well. Low self-esteem, which I already told you, low self-esteem, which you can see very clearly, their self-confidence is very, very low, right? The way they're judging themselves is very low because they themselves know, either if you tell them, if you not tell them, they know that yes, they have a problem. And that is why they have been told to go always to a special ed room, which is not the solution. Going to a special ed room is not a solution. Special ed are the facilitators of their education, as the facilitators of their curriculum in their teaching pedagogy system. But that is not the solution that every class there asks the child that go to the special ed room and study. That means you're not doing a proper inclusive education in your mainstream education system. Next slide, please. Now, classroom behavior management. Now, coming to the second part of my presentation, which I told you in the beginning, that not only I will talking about the etiology, causes, and the characteristics of ADHD, I have to give you some plausible solutions for it, how you can do it at home, right? And for this, before starting with the classroom behavior management, after this, I'll introduce one important concept, an important therapy, which is very important, especially for the parents and the caregivers. Classroom behavior management is use very clear instructions. I already told, since their working memory is impaired, working memory is a part of your short-term memory, where we have three probable loops, three loops: a phonological loop, a visuospatial sketchpad, and a executive loop. We have a three loops, and based on this, you can see the executive domain is what they are trying to do is that they very clearly take the instructions from our, you can say, from a phonological loop and a visuospatial sketchpad, and then they act as a leader that where to send the messages to the other parts of the brain for the execution, which is for these kids, it is little difficult to execute those things. So what is the solution is, give a very clear, simple instructions, not using too much of jargons in your instructions, right? For which the child can understand, right? So what we can do is, once you give an instruction to the child, ask the child to repeat it, what I told, such that you cross check have the child is understood or not. Break task into smaller tasks, right? Smaller parts. Give a task to the child, give step by step. Don't explain the entire assignment at one go. Give one instruction, wait for the child to execute that, then give the second instruction or a second task to execute. If we do it, actually, I know that yes, it will be a little time consuming, but yes, if you want to see a child's improvement in the child's behavior or in the cognitive domain, you have to give an extra time, which CBSE has also given. An extra time is actually allotted for these neurodivergent individuals, which is very, very important. Seat near the teacher, which I already told you, the neurodivergent individual need to sit near, close to the teacher, where a teacher can have a quick view or a quick glimpse to what the child is actually doing. Use visual schedules. Rather than too much of auditory, use visual cues. Use certain, you can say, pathways where you can and make the child understand the lesson entire through visual cues, through visual, you can say, learnings, through certain videos, certain activities where the child can grab the attention very easily, right? A positive reinforcement, which is very important. I told you very clearly, there are certain behavioral tips, right? There are certain behavioral therapies which you can do it even at home as well. At classroom, what we can do is, generally the teachers, what they do is, they use certain emojis, right? They use certain smileys, right? They draw it in the palm of the child in order to ensure that yes, the child did good work. That's why they've been drawn a smiley on their palm, which is very clearly executed. Just give me 1 second time. I'm coming. Just give me 1 second.
So I think आप लोग सभी के सभी लोग यहाँ पे ADHD के बारे में कुछ ऐसा भी जान रहे हैं जो अभी तक शायद प्रोफेशनल होने के बाद भी आप नहीं पकड़ पाए। उम्मीद है कि ये सारा सेशन आपके लिए सही जा रहा है। आइए, मैम फिर से हमारे साथ कनेक्ट हो गई थी। प्लीज मैम कंटिन्यू।
Yeah, so sorry for that. So you can do a positive reinforcement where you can use a token economy. Now, token economy is a very, very, you can say, a very famous and a very, you can say, very often used in the classrooms by the teachers, where they give a kind of token to the child in exchange to their good behavior, in exchange to the work which has been done, in exchange to their assignment which has been assigned to them. And after collecting 10 tokens, you are giving probably a good thing for which the child is have a wish, or maybe a reinforcement, a verbal reinforcement, a clapping in front of the class, giving a kind of positive reinforcement to the child in front of the other students that boosts their self-esteem, and that gives a sense of responsibility and a sense of belongingness that yes, I am a part of this classroom, right? A frequent breaks, which is important. Frequent breaks, yes, you can give. After 20 minutes, yes, you can ask the child, and okay, what you have done is just see that you rub the board. Give a kind of small task. It's not that they cannot execute, right? If you give a small task to the child, let's suppose you only give one thing to the kid, that you ask the child to write today's date, right? Write today's which period is there, which subject's period is there, and which what is the date of the today's date is there, right? Or which period is there. If you give them small instructions, right? If you give them small responsibility to the child, you see the child is try to learn gradually and try to see that yes, I am a responsible person, right? Also at the same time, they try to develop a cohesiveness within themselves, which is absent, very clearly absent during the initial years when the child got admitted in the schools, right? So these things can be very frequently can be done by the teachers, by the shadow teachers, by the subject teachers as well. Minimize distractions. Don't use too much of, you can say, posters in the soft board in the classroom, right? You can use good quotes, a positive, you can say, an ambience should be there at the classroom where the child is less distracted, right? The child can read certain, because they don't have any kind of reading problem, so they can read certain good quotes through which they can understand, and help these quotes at the classroom level by the class teacher or the shadow teacher, who can make them understand what is the meaning of those quotes. Clear? These things, if we do it in a frequent way, which I told you in the zero periods, right? Also by the subject teachers, you can see a clear difference between what the child was earlier and what the child is learning after doing all kind of engagements, right? So in a very quick just which I wanted to tell you over here is, see, a neurotypical children is over here and an ADHD child is over here. There's a huge gap, right? We cannot fill this gap. This gap cannot be filled at any cost. There's a no permanent cure, which I already told you, right? There are medication, there are stimulants which can be given to ADHD kid, but there is no permanent cure. But the solution is, you can be as an active agent, you can use certain activities, certain strategies, certain tips where you can help the child to manage their behavior and learn certain skills. Next slide, please. Now, coming to the classroom accommodations, not the classroom accommodation, which we can do it very clearly, is extra time for the assignments, right? Yes. As I told very clearly, CBSE bylaws have given certain clocks. Our government is giving so much of opportunity for these kids. It's not that they are not included in our society. Again, coming to NPC curve, your normal probability curve very clearly says we are all inclusive. This is a bell-shaped curve. If we are putting over here, these are the skewed areas, and these skewed areas need to come over here. When they need to come over here, what kind of arrangements we are doing, right? So we need to give an extra time for their assignments, for their exam time. Also, 1 hour extra has been given by the CBSE for these neurodivergent individuals. Structured routines. This is very important, that you have to set your routine in a very structured way. A slight disruption in their routine will lead to a disruptive behavior for the neurodivergent individuals. Use movement-based learning, right? Don't ask the child always to sit and learn. Use certain activities, which I told you, infrastructural or systemic changes can be done within the classroom arrangements. You can do certain activities in the classroom where you can make use of certain movements. Now, when I'm asking the movements, I'm actually helping this ADHD kid to channelize their behavior. They have so much of energy. Where to channelize? That is important. And if you cannot channelize their behavior, their energy is within themselves. And that's why there can be an emotional outburst when they cannot able to align with the other peers, right? So certain movement-based learning, right, can be done in the classroom, especially till grade 8. There are certain papers which you can, certain subjects which you can do it through the activity-based. through their movements, through their some kind of team building exercise, some kind of, you can say, collage, some kind of any other activities where they can do certain activities where the child see that yes, they are totally have a belonging with the other peers. Flexible sitting. Flexible sitting can only be done if the child can able to understand, but with a close buddy, right? If the flexible sitting is not there, it's very clearly permitted as the child to sit in front of the class teacher, or very clearly a subject teacher or a shadow teacher, where a constant prompting will be there, right? Task reminders. Now you have to do a to-do list, which we all do it, right? Being as in working in a corporate sectors, working in the private universities, government sectors, people little less, but in the private government or the private sectors or the corporate sectors, we all do a to-do list in the morning. What we need to do, set the same thing for them as well. Task reminders. These are the things which you have to do for today's task. Set a very rational task which they can do. Don't set any irrational work. Don't set any unrealistic goal which they cannot able to achieve it. Set a realistic goal, only one goal a day, and you see they are doing wonders, right? Use of certain assistive tools. Now there is a, thanks to AI, there are so many of AI good tools through which ADHD children can also be improved, but not too much of screen exposure, right? Behavioral charts. Now, this behavioral chart can be very clearly done by the special ed children, or sorry, a special educator. What they can do as a special educator is, in their rooms, they have prepared a behavioral chart. Okay, on Monday, your mood is like this. You did all these things. So your behavioral chart is something coming close to that you are moving a little bit below 50%. Right? On Tuesday, when the child is actually settled down, you see the child's behavior is actually 50 or above 50%, where the child is now settled down in the classroom. So these kind of behavioral charts you can prepare at home as well as at the special ed room. The special educators, they do it in order to have a mapping or and to have a tapping to what kind of behaviors they are doing at the school level. Clear? Which gives, generally now if you see in the report cards, there's a profile which is being given, which earlier in our report cards it was not given. Why the profile is being given, that gives a very quick glance to the teachers and to the caregivers and the parents in order to see that where my child is falling at the present level. Right? In order to see the profile of the child, we also see subject wise, we also see behavior wise, and the behavior wise profile in very less schools which I have seen. Right? Another component which can be added over here is how the child is engaged with the other kids as well, which can be tapped through a behavioral domain as well. Right? Also, a list of activities which the child has participated at least 10 to 15% in these activities and what they have come up with. So these things can be given in a report card. At least the parents can also take an active role to understand all these things. Now, strategies at home, which is very, very important, which over here now I will introduce a therapy which is called a filial therapy. Filial therapy is being used widely in the Western context, which has been developed by Louis Gournay in 1960s. Now, filial therapy is a therapy which is only for the parents and the caregivers. The basic assumption of the filial therapy is that parents and the caregivers are considered as an active agents of the child's improved behavior or the child's behavior management. Why? Because you cannot say that I am sending my child to the tuition, I am sending my child to the therapy, my job is done. No, your job is not at all done. Your job is only will be done when you will be involved with your kid. When you will try to understand your child, what are the red flaggers? What are the things that the child is struggling into? What are the things which you need to understand on what at home, what accommodations which you can do it at home, such that very clearly you can see you can develop an emotional bond with the child. right? That is important. So filial therapy is very, very often used now for the last 5 years. Filial therapy, the clinical psychologist and the special ed, they're actually encouraging the child or encouraging the parents to be an active agents of the child's improved behavior and be an active agent in order to understand what are the child's behavior and the challenges they are facing. In this context, one thing which I want to quickly quote over here is, you must have seen a movie of Tare Zameen Par, which is a very inspiring movie. Very inspiring. That inspired me a lot, and that gives me so much of inspiration. For with this movie only, I decided that I will do my doctoral program in this neurodivergent area or neurodivergence area. I've decided on this that today, yes, this is the movie which make me learn so many things, and that is the day when I pondered so much, thought so much in a very deep way, not to understand why not to do my doctoral program in this particular area where I can actually help certain kids, right? Doing certain, your work is always helping yourself. But if you're helping one kid also with this kind of problem, or you can say a neurodivergent kid, you're actually doing a good work. You're actually helping that child to make them understand and make them learn certain things. So what the strategies is, make routines, which is very, very important. Set a proper routine. If you're not setting a routine for a kid, you can see a child will do their work, parents are doing their work, then the outcome will be, it will be a messy thing, right? Because after the day, you will start blaming the kid that you have not done this, you have not studied, you have not done this, you have not. Reflect back. Have given a time to the child, right? Or you were also engaged in the mobile phones, which is very important. If you are setting a limit to the child, you have to set a limit first to yourself. How much time you are giving to mobile phones? I can understand truly, because I'm also working in a private university where I can understand, for us, checking to frequent messages in the WhatsApp or in the Gmail or the mails is very, very important. But when you have a kid, you have to give a quality time, at least 1 hour or less, or maybe 45 minutes to the child, where you only interact, not letting your mobile phone come in between, which is very important. So you, when setting a routine, set that routine for yourself as well, which is first. Use consistent rules. Rules should be there. That rules is not there. I'm talking about the reprimands. I'm not talking about the negative reinforcement. Give a proper rules, and that rules has to be consistent, right? Give positive feedback. Give a very appreciation. Okay, good. You did a good work, right? You have actually make me proud. Make them understand that yes, your work, your deeds are actually helping me, and I'm feeling as a proud parents. Make them understand that you have the ability. You can do it. These are the certain motivating words which can actually help the neurodivergent kids to make them groom, to make them learn, and to enhance their self-esteem as well. Set realistic expectations, which I already told very clearly, that setting a realistic goal is very, very important. Don't set any unrealistic goals. Don't do any kind of comparison with a neurotypical kid, right? Because you know very clearly that my child has a problem. If a child is doing at least securing 65, 70, 72%, that's more than enough for them. Praise the child. Try to understand, yes, your child has a problem, accept that, rather than to showing that resistance. Limit the screen time, which I already told. Create quiet study spaces, less distraction. Home environment should be little conducive, right? It should be friendly environment. It should be a peace environment, right? And also, which I would really want to say over here is, try to maintain a environment where the child feels that yes, it's an environment where I can learn, where I can interact with my parents, right? Either of the one parent or either both the parents. That's all depend upon the context. But you can see that you are providing a proper space to the child for their learning. Encourage physical activity, which is very, very important. Now these days, if you see, children are spending more time on their mobile phones, on their tabs, on their PlayStations, rather than going outside the playground and play. What is hampering over here is, that is hampering their interpersonal skills, is getting hampered, right? That's the first important thing. Their physical activity, since they're not doing it, so their energy is not being channelized, and then getting easily tired, and because of this their eyes are so tired, then where they have to give a quality time to their studies, that is being hampered, right? So encourage a physical activity at least for an hour for each and every kid outside the park. Encourage them outdoor activities rather than indoor activities, which is very important. Next, please. Social and community strategies. Now you see, in Indian context, which I will very clearly see, and I have seen recently, I went to Philippines for an international conference on service learning. I've seen very clearly few things, and I observed they actually, you can say, encourage neurodivergence kids, right? They actually help these kids, and they actually give a kind of platform where they try to show their ability at a appropriate level. Now during our lunch time, all these neurodivergence individuals, they're playing their you can say mouth organ, their piano, their drums. They were doing it there and they're making a very clear and a good music, and they're providing a good ambience in order to see that yes, they are doing a good work. It's not that all the people are saying, oh, what kind of music he's playing, right? Or they're having a very sarcastic remarks, right? It's not at all there. They're encouraging the kids, that see how well they are doing it, which is absent in the Indian context, totally absent. Now if you see in Delhi NCR, which I can very clearly see, some of the educated parents, yes, they try to encourage the other kid that yes, see, apart from their disability or a disorder kind of problem, they are using their own abilities to you can say, to channelize their energy in different activities. You can say mouth organ, you can say playing drums, to play music or to singing. They are giving a due importance to it. But everything comes to the education, which is not at all good. Giving due importance to education, which was previously, it was there. Like back to our parents' generation, it was there that only education was being given a total importance. Now, our new education policy very clearly laid down a principle of vocational studies as well, vocational courses as well, which starts from grade 8, where each and every child, apart from their academics is important to some extent. It is an entry grade level, right, to going to the next level. Clear? But it's not that. There is not only the solution that yes, everyone has to secure above 85, everyone has to score above 90, right? That's not the solution. You have to see what is the caliber of the child is, which is very, very important, especially for these kids, right? So you have to prepare the child to make the other children understand that they are a part of your society. Now coming to this slide, which I can very clearly see from the picture, which you can see that generally these neurodivergence children, they get an avoidance behavior, right? They get a secluded behavior, that yes, other kids are not accepting them because they think, okay, this child cannot able to study, that child cannot able to play with us because of their so-called problems, right? But these problems can be very clearly remediated to some extent if you accept them, that they are a part of a team. So now it's a responsibility of the caregivers or the parents to make the child go to the playground and ask the other kids that you can also include this kid. You can also include in their activities, where you can see some kind of activities you can make the child do, where they can also feel a sense of oneness, a sense of cohesiveness, which can be there, which build their social skills, because that social skills is actually absent, especially if a child is a single child, totally absent. A role play kind of thing. Now to some extent, if you see, now mother cannot able to give all time, because if they're working, even if they're not working, they have so much of household chores to manage. So make the child a set routine, that going to the park every day for a hour, at least 2-3 students, make them familiarize or make them sensitize about their problems, make them understand that the child has certain problems, but yes, they can be a part of your game. They can play with you, and you can make the environment little friendly for them, such that they can also get a kind of friendly environment. They can build their social skills. At the same time, they can develop a bond with the other kids as well. Right? Next slide, please. Now, the therapeutic support, which I will very clearly say, which is very clearly designated to the psychologist, especially a clinical psychologist. It can be behavior therapy. Now, there are 9 behavior strategies which can be done by a behavior therapist. It can be token economy, it can be modeling, it can be exposure therapy, it can be systematic desensitization. Now, these are the jargons, which are the terms which not be understood by far everyone, right? Now, the one thing which, and also the occupational therapy, which is very important, CBT, medication if needed. Now, one thing which I wanted to tell you, if you're started with a therapy, right, don't disrupt the therapy in between. Consult the therapist always before the discontinuation. Because if you discontinue the therapy in between, what you see is the maybe a special ed or occupational therapist, they raise the child to this level. You discontinue, the child came to this level. Then what is this learning which happened to this part? It actually came to 0. Generally, the parents do this. Why? Again, back to financial, right? Maybe they think that it's an extra routine to take the child always going to the sessions, to make to accompany the child always. This is an added work which the parents think. Yes, I can consider it can be an added work for the parents, but yes, again, since you have to make your child groom, you have to make your child learn certain things which you can have to do it because you want a kind of improvement in your child's behavior, right? So occupational therapy is very, very important, especially for ADHD and autism. Very important, right? Medication is there for the ADHD. Stimulants are there, specific stimulants are there for ADHD, but try not to make it a routine habit. Continue it for 6 months, 8 months, consult a proper psychiatrist, make them understand how much if prescribed, then see that how much the child is taking that medicines, right? And then only if you see there is a change in the behavior, even if the medicine you cannot discontinue, consult the psychiatrist, consult the doctor, which is very important, right? Set a very clearly cognitive restructuring at home. Do certain home tips. You can do grain sorting activities, you can do clay activities, you can do very clearly sketching activities, mandala art activities, which very clearly you can set a proper routine for the ADHD kid, where you can see slowly and gradually the child is improving in his behavior. At least if you can see a 5% change in the child's behavior, you see you have secured the wonders, right? Clear? So to conclude my session, I would like to say, next slide, please, that ADHD is not at all, don't think that it is a problematic kind of behavior. Don't think that, don't blame yourself or don't have a guilt kind of thing that because of certain things, your child has been diagnosed with ADHD, autism, ID, or dyslexia. The only thing is accept the way your child is. That is very important, right? So over here, what is important is your early identification, early diagnosis is important, because if early diagnosis is there, the child can be given a proper therapy, right? A proper interventions, and at the same time, you can see as the age is increasing, the neurodevelopmental disorders, the problems can be you can say very clearly, you can see there are behaviors which can be eliminated as well. But with proper, you can say therapy, with proper home environment, with proper schedule, with proper routine, right? So with this, my presentation came to an end. I would like to end my presentation with a small quote. If a child can learn the way we teach, we must teach the way they learn. So this is a small lesson and a small quote, which I've used it, especially for both the special ed, the counselors, the parents, the caregivers, academicians, professionals, for everyone, we need to understand what we are not doing it. We should not, we should now start doing it such that you are helping a small kid to learn certain pathways because they have a right to learn, to grow and flourish. Thank you.
So, I would like to say thanks again for such a wonderful uh, and इंटरैक्टिव सेशन। उन्होंने 1 घंटे में मुझे लगता है ADHD के वो सारे डोमेन कवर किए जो करना काफ़ी टफ होता है। मैं बहुत बहुत शुक्रिया करता हूँ और जो भी हमारे पार्टिसिपेंट उन्हें सुन रहे हैं उन्हें सेशन कैसा लगा आप जरूर कमेंट के थ्रू आप बताएंगे। और क्योंकि आज थोड़ा सा समय ज़्यादा हो गया, हमने 5-10 मिनट लेट भी शुरू किया था, बट स्टिल ये काफ़ी नॉलेजेबल था, काफ़ी गागर में सागर भरने वाली बात थी। मैम ने थोड़ा फास्ट भी रखा, शायद इसीलिए कि बहुत कुछ कवर करना है, तो मुझे काफ़ी अच्छा लगा। मुझे लिटरली मेरा न्यूरो डेवलपमेंटल डिसऑर्डर पे लास्ट टाइम CRE प्रोग्राम था और मैंने भी काफ़ी कुछ अभी सीखा कि हाँ इसके ऊपर और बात की जा सकती है। और इन सब में कितनी अच्छी बात है कि ये लोग अलग नहीं होते हैं, बस ये अलग तरीके से व्यवहार करते हैं और हमें उस व्यवहार को समझने की सबसे ज़्यादा ज़रूरत है। तो मैं आपका बहुत बहुत मैम धन्यवाद करता हूँ, बहुत बहुत आपका शुक्रिया। और जो भी साथी इस प्रोग्राम को देख रहे हैं तो वो किसी भी सोशल मीडिया के फेसबुक, इंस्टा और लिंक्डइन या फिर यूट्यूब से उसके डिस्क्रिप्शन में इसके सर्टिफिकेट का लिंक है, वो क्लेम करना चाहें तो कर सकते हैं। आप फिलहाल ये पर्सनालिटी केयर फाउंडेशन के अलावा राज आलमपुर के नाम से भी जो चैनल है उस पर भी आप सुन रहे हो, साथ साथ जो हमारी फाउंडेशन है उसके यूट्यूब चैनल पे भी आप इसे सुनेंगे। मैं मैम का बहुत बहुत शुक्रिया करता हूँ, उन्होंने इतने कम टाइम में इतनी बेहतरीन चीज़ें रखी। सच में ये बहुत ही ज़्यादा नॉलेजेबल हैं और मैं कहूँगा कि जो भी पार्टिसिपेंट हैं यदि वो इसमें कुछ कंट्रीब्यूशन करना चाहते हैं तो एक सिंपल सा कंट्रीब्यूशन करें, मैम की वीडियो को डियर डियर कुछ ऐसे लोगों को जरूर भेजें जो जो एक्चुअल में उनको ज़रूरत है और शायद कोई ना कोई एक ऐसी बात मैम की ज़रूर आपको या उनको समझ में आती है कि जिससे उनके बच्चे की ज़िंदगी बहुत बेहतरीन हो सकती है और शायद एक जागरूकता आ सकती है। उसे एक स्टिग्मेटिक तरीके से एक लेबल करके बच्चे को नहीं देखेंगे। मेरा इतना पूरा भरोसा है कि इस 1 घंटे में इतना कुछ तो ज़रूर सीखने को मिलेगा। मैं आपका बहुत बहुत थैंक यू करता हूँ। जल्द ही किसी दूसरे वेबिनार में हम सभी लोग मुलाकात करेंगे। तब तक खुश रहिए, खुशियाँ बांटते रहिए और जो स्पेशल पॉपुलेशन के लोग हैं उन लोगों के ऊपर दया न दिखाइए बल्कि उनको साथ में खड़े रखने के, साथ में कंधे से कंधे मिला के कैसे हम उनको साथ ले सकते हैं इसके ऊपर काम करिए। थैंक यू सो मच। थैंक यू टू ऑल पार्टिसिपेंट्स, उन्होंने भी इतनी देर समय दिया। आप सबका भी बहुत बहुत शुक्रिया। थैंक यू सो मच।
Thank you. I can leave the portal, right?